good afternoon to all. I am Dr. Divya Singhal, Vice President of North. On behalf of Delhi Gynae Forum, I welcome you to an important session on two burning topics which are of immense importance in the current health scenario. These are obesity and breast cancer. We have eminent speakers and chairpersons who will share their expertise and experience. But before that, it's my pleasure and an honor to welcome Dr. Harish Gupta, sir, who has given us his precious time. Dr. Harish Gupta, sir, are you there?
Yes.
It's a pleasure and an honor to introduce him. He is the executive member of the Central Council of Health and Family Welfare, Government of India. He is a member of the National Medical Commission and was with Delhi Medical Council. He is former president of DMA and IMA EDB. We request you to share a few thoughts, sir.
Thank you. My compliments and very good evening to all my respected seniors and all colleagues. And thank you, Madam Sharda Jain, for inviting me today or including me today in your ever-lasting endeavor of imparting knowledge, skills to all of us. Thank you, ma'am. It is my privilege to introduce one of the really legendary figure in our surgical fraternity, Dr. Yogesh Agarwala, my elder brother, who has been a real teacher for laparoscopic surgery and has been one of the torch bearers in this laparoscopic and bariatric surgery in Delhi, NCR, and maybe at the national level also. As we know that today we are seeing more and more cases with the obesity, and obesity along with this also brings comorbidities to the patients in form of hypertension, diabetes, dyslipidemia, and non-alcoholic liver disease. So there are so many issues which are there, and people who are not able to lose weight themselves, they just keep on pulling with this and attract so many other comorbidities in form of heart disease, knee problems, and so many and so forth. So bariatric surgery has come a long way in this, and it is practically, I would say, it is not a cosmetic surgery or maybe just a weight reduction. It's a life-saving surgery for few. We have seen patients with 150 kg of weight, 130 and 140 who have practically lost interest in their life and who have practically given up that they will not be able to reduce their weight and will not be taken care of for their uncontrolled diabetes, their impending heart disease. So bariatric surgery has come as a life-saving tool for them, and it has really shown improvement in all these liver conditions, their metabolic issues, their cardiac issues, and I think it's a new lease of life for all those people. So we are very fortunate Dr. Yogesh Agarwala has spared his time today. As we all know that Dr. Yogesh has been there at majority of the very good hospitals. At Max Hospital, he's been the director and head at Max Saket. He's been at Fortis Memorial Research Institute, Gurugram, has been a vice chairman at Sir Gangaram Hospital, and we are fortunate he's from our East Delhi, and today he'll be us on the metabolic effects of bariatric surgery. So I'll request Dr. Yogesh to enlighten us on this very important subject. Dr. Yogesh, please.
Thank you, Dr. Harish Gupta, sir. I'd like to introduce the chair before we hand over the mic to Dr. Yogesh Agarwala. And as we have heard from Dr. Harish Gupta, bariatric surgery has reached a turning point. It's going to change the treatment modality for so many metabolic disorders. It's a life-saving surgery, as sir said. And to tell us more about this, and to share their experience, we have, of course, Dr. Harish Gupta, who is also a well-known laparoscopic and general surgeon. We have Dr. Sharda Jain, ma'am, the teacher of teachers. She needs no introduction from us. We have Dr. Sangeeta Gupta, who is ex-HOD OB-GYN ESI Hospital, Basaidarpur, and she's also the founder secretary of DGF. And she has many accolades to her credit. Dr. Ruby Bansal, who is head of infectious disease at Yashodhara Hospital. We all know her, we all love her. And we have Dr. Purnima Sharma also with us. So over to you, Dr. Yogesh Agarwal, sir.
Thank you so much, Dr. Divya Singhal, ma'am, Dr. Harish Gupta, and all executive members of Delhi Gynae Forum, especially Dr. Sharda Jain, for giving me this opportunity to talk today. Well, I'll be taking you through the topic allocated, that is the metabolic effect of bariatric surgery. You're getting my screen?
Yeah.
Thank you.
Well seen.
Well, before I get onto this topic proper, I would really thank Dr. Harish Gupta for saying so kind words about me. In fact, it is the other way around. I look up to Dr. Harish Gupta as one who is, apart from being a very busy surgeon, is a very busy medical activist who has taken innumerable causes for the benefit of the medical fraternity, and his passion of working rubs on all of us. Now, coming to the subject, the metabolic benefits of bariatric surgery. Well, my presentation is more of a personal experience. Of course, there's some evidence which I have attached in the presentation. And I hope that I am able to do justice to the topic by the end of the presentation. All of us who are here today and who are there present in 2022 have been witness to innumerable revolutions in our life. The IT sector was a major revolution in the way we go about our daily routine, we work, we communicate. Within seconds, we can communicate from one end of the globe to the other end of the globe. It's a major revolution which has happened in our life. India discovered water on moon, a major discovery and a major revolution. And who would have ever thought that the so powerful dictators as Saddam Hussein would bite the dust one day? Well, all these revolutions we have seen in our own lifetime. But in spite of that, based on our teachings, our practice, our beliefs, some of our thoughts are still tentative, still caged. Through my presentation today, I would like to share some whiff of fresh air to shake up our thinking, to enhance our thinking, and to let our thinking go in a newer direction so that we break the shackles and come out in the open. Well, now after my stint at all the major corporate hospitals in Delhi in senior positions, I have now dedicated myself to my own place, the Life Care ABS is the surgical division. And our motto at our place has been taking our patients from point A to point B through all the factors to all the places in life. And basically our motto is from point A, which is unhealthy, to point B, which is healthy, has been our endeavor and will always be our endeavor at Life Care. All of us would agree that incidence of obesity is increasing. In 2000, the severe obesity categories like morbid obese, super obese increased significantly. By 2005, the overweight and underweight population in the world were equal. And tragically today, obesity has surpassed starvation. More people are dying due to obesity than starvation. There are about 2.2 crore obese individuals in India. Because this is a very conservative estimate, I would say it is many times over 2.2 crores. And one third of Americans are affected by obesity. Overall, 1.2 billion people are there worldwide who are fighting obesity. Obesity is a chronic disease. Some say it is a chronic subcortical brain disease because of a neurogastric pathways to it. WHO defined obesity only in the year 2007. Prior to that, it didn't recognize obesity as a disease. In 2007, it said obesity is a disease in which excess fat is accumulated to an extent that health may be adversely affected. So friends, obesity is a medical disease like any other illness, like typhoid, like malaria, like cardiovascular disease. It is a disease and it needs treatment. And it is not a cosmetic problem, definitely not a cosmetic problem only. Now, I would like to ask one question. What is common between obesity, sterility, and erectile dysfunction? And the common factor is you don't have this problem by your own choice. It's a disease which happens. Similarly, obesity is a disease which happens. None of us would want to be obese by choice. And obesity is a state of positive calorie balance. And for majority of us, I would say, eating is a reflex. Morning is a time for breakfast, then lunchtime, dinner time, snack time. So practically, it is a reflex. When the time comes, we start eating. And we eat when we are hungry. We eat when we are not hungry. We eat before eating and we eat even after eating. To celebrate anything in life, whether love, success, promotions, childbirth, etc., we eat. And we even eat to mourn the demise of people. So we eat, friends, we eat and eat. It being a reflex in everyday life of ours. It has been postulated that if we eat 100 calories more every day than we burn out, we will put on 5 kgs of weight in 1 year's time. And at times, eating becomes a sort of an addiction. Exercise, on the other hand, as eating is increasing, exercise is decreasing. It is rightly said that most of us adults consider currency counting a major exercise. And it is also said that sometimes people lose weight by getting an haircut. Obesity is a problem and it is not a visual index. कि मैंने देखा बोला कि ये obese है, ये normal है. It has to be measured. And all of us know there are various methods to measure obesity, BMI, waist hip ratio, etc. And this BMI chart, everybody of us is aware. But only thing which we are not, majority of us don't know, that BMI is also known as Quetelet index, and it was designed by a Belgian academician, a statistician, Jacques Quetelet, in 18th century. Primarily, it was done for the purpose of getting life insurance because it was believed that people who are near normal BMIs are healthier than compared to whose BMIs are higher. He was a non-medical person, but he developed this beautiful chart, which is even valid today after more than 200 years. Now, friends, all of you would agree that obesity is the mother of all diseases. Every organ from head to toe is affected, and it is due to the metabolic component of excess fat and due to the excess fat itself. So both ways it is affecting the health of an individual. The longevity of life is proportionately increased with the increase in obesity. Increase in grade of obesity. A super obese individual is much more likely to die at an earlier age compared to a normal weight individual. So friends, half of the world's population as of now is fighting the battle of the bulge. This is metaphorically speaking, but historically speaking, Battle of the Bulge was the most fierce battle fought by Hitler in World War II. It was Hitler's last gamble, and it was the bloodiest battle wherein 80,000 soldiers were killed or incapacitated because of the war, or because of this Battle of Bulge, which was fought between the Allied forces and Hitler. And this is in the form of a beautiful movie by the name of the Battle of Bulge. So colloquially, this has gone for us who are fighting the epidemic of obesity. I will not go into the other treatment modalities of obesity because that's a different subject. I'll straight away jump to bariatric surgery. Bariatric surgery it is derived from the word baros, means weight. So any weight reducing surgery is bariatric surgery, and is the only effective and durable tool for weight loss. And there are many options available depending upon the patient's profile and the risk status, etc. The first bariatric surgery was apparently noted in 10th century, wherein King Sancho of Spain was operated by this gentleman on the right, Mr. Sharpat, Hassan ibn Sharpat. And the surgery which was done, that he was an obese king, and the surgery was done by stitching his lips so he could not eat anything. This was the first, possibly the first bariatric surgery noted in the world. By definition, bariatric or weight loss surgery is a spectrum of surgical procedures performed on obese patients. It is offered to a very select group of obese individuals. Not everybody is obese. It is basically offered with BMIs above 40 or BMI above 35 if patient has comorbidities like diabetes, hypertension, etc. There are several indications which are coming up for even operating at lower BMIs, but they have still not found the consent of the societies which govern the bariatric surgery. Basically, bariatric surgery can be described into restrictive, malabsorptive or combined procedures, and there are different procedures based on these modalities. So, my question is, can surgery make these obese individuals be born again? And my answer is a vehement yes. And I'll take you through a couple of quick examples of what bariatric surgery does for an individual to be born again. Swamiji of Akshardham, pre and post surgery. All these are my patients who I have taken consent at the time of surgery for sharing their photos and their experiences in any which way I deem fit. This is another young 22-year-old boy, 214 kg now, doing so well. This is the heaviest I have operated, a 318 kg individual. He was an Iraqi gentleman, again a 24-year-old boy, young boy I would say, and now he is doing extremely well. The family of obese diabetics, all mother, father, chacha, beta, all obese diabetic individuals, and this is sometime after the surgery of these three individuals. A young lady who walks into our IVF center, Dr. Sharda Jain at times get angry on me, don't do bariatric surgery here because it takes away our IVF patients, but that's a fact. Majority of IVF patients who walk in with very higher BMIs and are not able to conceive, just conceive by natural way mechanism once they lose weight, by whatever means. And here is an example of a lady who underwent bariatric surgery and then conceived subsequently. Again, a husband-wife got a surgery together, and this is the result. Another happy family, brother, sister, mother. All three operated same day. This is at 6-7 months of time, and this is about at 1 year after surgery. Again, a husband-wife combo. So basically, again, I ask a question. After seeing these examples, what do we appreciate? We appreciate a significant weight loss, improved look of the patients, and definitely happier patients. But my question is, what we do not appreciate? We do not appreciate the marked improvement in comorbidities, because just by look, no improvement in comorbidities can be assessed, but there was a marked improvement in comorbidities, and it is a new lease of life for these individuals who had the guts of undergoing surgery and reliving their life. Extensive metabolic changes accompany bariatric surgery based treatment of obesity. Again, a question, what these individuals shown here have in common? They have in common the remission or cure of their diabetes with the loss of weight following bariatric surgery. Weight loss in these individuals resulted from relief of joint pains and deformities. This child in the center, she came to me from Nigeria at Max Sake. She was unable to walk, had bad knees, and as you would say, she was taking help of a cane. 6 months post bariatric surgery, she sends me a video on WhatsApp dancing. That is the benefit of weight loss following bariatric procedures. Depression, psychosomatic problems is a bane of obese individuals because they sulk from society, they sulk from socialization, and bariatric surgery offers them a significant relief from their depression. So friends, all of us would agree that apart from the mere excess fat which an obese individual carries, he carries a lot of other burdens. And one of the major burden on an obese individual is the metabolic component, the metabolic syndrome as we call it, which is characterized by central obesity. ये खाते पीते घर की निशानी नहीं है. It is a real problem for individuals, the central obesity, because the peripheral and the visceral fat are metabolically active atom bombs, actually to say, because they induce lot of insulin resistance and cytokine related inflammation. Hypertension, very common component of metabolic syndrome, present in almost majority of individuals who are obese. Diabetes mellitus, no need to say that diabetes mellitus and obesity go hand in hand. Dyslipidemia, almost every individual who undertakes a lipid profile test has some or other form of dyslipidemia. PCOS, I need not educate this really educated group of gynecologists on the problem of PCOS. Non-alcoholic steatohepatitis, as Dr. Harish Gupta had pointed, the fatty liver, which we conveniently ignore on an ultrasound when the patient shares with us, is a real problem with these obese individuals. And one of the reasons of infertility in male counterparts is erectile dysfunction. Fatty liver, as I told, we conveniently overlook once the patient gets a report and it is reported on ultrasound that patient has fatty liver, grade 1, 2, etc., etc. But it has to be considered very seriously. This is the liver which it should look like on a visual inspection. This is the normal healthy liver. This is an example of fatty liver. Everybody of us would appreciate the fat deposits within the liver. And if this is not taken care of actively by the patient, guided by his or her physician, then would lead to a not so good a situation of cirrhosis and subsequently its complications and problems. So fatty liver is an area which should not be ignored and should be handled on a very serious note. Before I go further to elaborate on the benefits regarding the metabolic syndrome part, let me just put in a word about the insulin resistance. Visceral adipose tissue is accumulation. There is a direct correlation with insulin resistance. With visceral adiposity, there is always a fatty liver in place. And because of this metabolically active visceral adipose tissue, it causes inflammation and inflammatory cytokine production, leading to insulin resistance and a chronic inflammatory state in the body. Now, coming to subject specific, like each part of the metabolic syndrome specific part. First, starting with diabetes. This is one very good study. Out of 2460 patients who had type 2 diabetes, they were assessed on their prevalence of their BMI. 52% were obese, that is BMI more than 30 kg per meter square. 23% were severe obese, BMI is over 35. So frankly, 3/4 of type 2 diabetics were either obese, overweight, or severe obese and beyond.
The meeting नहीं leave over.
So obesity goes side by side with type 2 diabetes mellitus. Diabetes and obesity is a deadly combo and is one of the leading causes of premature deaths in individuals. In my personal experience of between 2006 and 2017, this is data from that time only, totally I had operated 411 cases. And the mean BMI was 30.5 and diabetics were almost about 70% were diabetics, with diabetes standing on more than 10 years and an HB1AC of 9.41. Following surgery, their HB1AC reduced to less than 6.5% in almost 82% of patients. So beyond the glycemic control which the bariatric surgery offered, there was resolution of dyslipidemia in almost all patients, remission of hypertension. By remission, we would say either reduce in the dosage of antihypertensives or complete cessation. There was definitely a benefit in the nephropathy which had been established to the tune of more than 80%. So when we are basically just dilating on the diabetes part, when we are treating diabetes, there are 3 challenges which an individual as a patient and their treating clinicians face. The compliance with long-term medical care is poor. Even with the best of care, with drugs, diet, exercise, taking care of one's diet, etc., the results at the end are disappointing. A good control is almost out of reach. And there is disappointment with some drugs. All these drugs which I mentioned below came up with a lot of bang, but they fizzled out equally faster because either they were not giving adequate results or they had their side effects. So need of the hour to manage the scourge of diabetes and obesity is to have a new paradigm, a new window, a new thought process. And to give flip to this thought process, there was a diabetes surgery symposium in Rome in year 2007, where the consensus statement was that gastrointestinal surgery may be appropriate for treatment of type 2 diabetes mellitus. And this only emerged, this consensus only emerged based on evaluation of a large number of bariatric patients who had undergone bariatric surgery, and their results were extrapolated onto the metabolic part, and understanding that it gave a major remission to individuals who were type 2 diabetics. So even at that point of time, it was thought that diabetes probably is a surgical disease cured by surgical intervention. Well, to give Philip to my point of view, my thinking and the consensus statement, these three individuals, all of us know, they are VVIPs in our country. Of course, Mr. Jaitley is no more, but all these three individuals were obese diabetics who underwent bariatric surgery, and two of them are reaping excellent results of that. I was associated with the surgery of one individual, and we are very sad that Mr. Jaitley is no more because of his other medical issues which caused his early demise. In the recent past, for last decade and a half, there has been a lot of news, lot of interest in bariatric metabolic surgery. And this has happened, and this surgery, as I told you, the first reported case was in 10th century. This surgery is not new. Even the Roux-en-Y gastric bypass, which is one of the standard procedures of bariatric surgery, gold standard of bariatric surgery, has been done for last 60-70 years. But for last about 2 decades, this surgery is being done through minimal access approach, thereby making it much more convenient, much more safe, and much more patient-friendly surgery. That is why the interest is gradually increasing, and it has been established beyond doubt in these last 2 decades that this surgery is safe with minimal morbidity and mortality. The benefits of surgery are 3. It gives us a much better control or resolution of diabetes, marked reduction in complications and morbidity because of diabetes, and superior quality of life and longevity. Imagine an individual who is on a fistful of medication every day, twice a day, thrice a day to control his diabetes, and still has a poor control, undergoes a bariatric procedure for also his associated obesity, and he is off all medications for his medical problems, for his diabetes. Definitely a far superior quality of life and longevity. There is enough evidence in literature now to support, enough studies, enough number of patients to support that metabolic surgery or bariatric surgery is one of the way forward in treating uncontrolled diabetics. A lot of studies available which shows a resolution from 80% to almost close to 100% in their studies. We did a study when I was at Fortis Memorial Research Institute. We studied the metabolic surgery in lower BMI patients, 30 to 35 kg per meter square patient who had their BMIs, in low body mass index patients, and we found that almost 85% of our patients who underwent a procedure who underwent a metabolic procedure achieved euglycemia and were on no anti-diabetic medications. Almost all of them stopped oral hypoglycemic agents, and in a small group of individuals who 3.8%, there was no remission, and probably these were individuals who had diabetes of more than 10 years duration, or their C-peptide levels were very low on investigation. So when we talk of obesity and diabetes highway, the diabesity highway, it's an inflammatory state, it's a systemic inflammatory state. Obesity is a dead end. If you have severe dyslipidemia, your lifespan is shortened. With hypertension, lifespan is shortened, as well as the complications like stroke or a CHD. And type 2 diabetes mellitus with all its complications is well known. So the only exit through this inflammatory highway is to take a exit of metabolic surgery. Dyslipidemia, I need not say, as I told you, we investigate majority of obese individuals would have a deranged lipid profile. Herein, I would like to share a personal experience. On the left-hand side, you see this young girl. She came to me when she was 4 years old. This is almost about 10 years back. Today she is 14. She came with cholesterols in thousands. She had lost 2 siblings, 2 brothers of her own, to severe hypercholesteremia. And they died at the age of 2 years and 3 years. She came to me at the age of 4 years. She was lean and thin girl, but with cholesterol of thousands, a familial hypercholesteremia, characterized by all these clinical points. At that time, I discussed this case with the person from whom I have learned bariatric surgery, Dr. Mahendra Narwaria from Ahmedabad. He is my 10 years junior, but I call him my guru in bariatric surgery. So we discussed this case. I called him over and we operated this young girl. We did a Roux-en-Y gastric bypass in this young girl who was much below, she was 18 BMI when we operated her. This was not a bariatric surgery in her, it was a metabolic surgery we did in her. And today she is a young, aspiring doctor to be a girl, living a very cheerful, healthy life, and her cholesterol levels are all within normal limits. She gets herself tested now twice a year and sends me the reports on WhatsApp with her cheerful, smiling face. So, an example of that metabolic surgery not only benefits the obese individuals, it can work wonders in non-obese individuals, of course, in definitely very selected cases. Obesity, hypoventilation syndrome, obstructive sleep apnea, snoring. When you see these obese individuals with so heavy weights, 150, 200, 250 kgs weight, one of the main problems is their respiratory system. Obesity, hypoventilation syndrome is a real problem because of the restriction of the chest movement because of excess fat. Obstructive sleep apnea and severe snoring, as reported by the partners or the siblings of these patients, is a real curse. Post-bariatric surgery, both these conditions show a remarkable improvement within the first month. And here I would like to again share an experience. All of you would recognize this gentleman, Dr. Hathi, the character in Tarak Mehta Ka Ulta Chashma, the popular TV sitcom. I have not treated him directly. It is through one of my friends' experience, Dr. Lakdawala, with whom I had worked at Fortis Memorial Research Institute. He treated this gentleman and he narrated to us that he was hospitalized because of his super obesity. He was 65 BMI and he came with respiratory failure. He was on ventilator for almost 3 weeks and there was no possibility of him reverting from a ventilator. And when the family, after extensive counseling, took a decision for him to undergo bariatric surgery, Dr. Lakdawala had operated this gentleman and he came back from ventilator, had a good about 10-12 years of active life, entertaining all of us through his beautiful acting. And of course, he passed away prematurely, but 10 to 12 years of his life, when he was almost gone, happened only because of the possibility of bariatric metabolic surgery. This is a picture of one of my patients who had to undergo a bariatric procedure. He went in, we found his liver to be cirrhotic, NASH, non-alcoholic steatohepatitis. This is the view from below. We are doing a procedure and this is the view from below the left lobe of liver, a cirrhotic liver. We completed the procedure. Patient did very well post-op. About a year down the line, he developed gallstones, for which we went in again. And to our utter surprise, this is the liver we found. compared to the previous liver, this is the liver we found at 1 year. A remarkable healing from a cirrhotic liver to a near normal liver. So a reversal of NASH after weight loss is again a possibility, highlighting the benefit, the metabolic benefit of bariatric surgery. Now coming back again.
Dr. Yogesh, you have to cut down your presentation.
Just 2 minutes more, just one. Now PCOS, I need not dilate, anovulatory cycles causing infertility. So basically we have to lose weight to get pregnant. So take home message is paradigm for treating diabetes and diversity is changing globally. Multimodal approach is required to diffuse the time bomb of metabolic syndrome and obesity. Bariatric surgery gives a second chance to life to be born again. Liposuction, friends, I would like to reiterate, it is not a weight loss surgery. It has no metabolic benefit. It is just sucking off some portion of the fat from some part of your body where you want to remodel it. So in conclusion, metabolic surgery is definitely going to stay there and give us much happier and healthier patients in times to come. Thank you very much for your kind attention. Sorry if I exceeded my time.
No, thank you, sir. Thank you for a very interesting and very informative presentation and talk. And we have so many messages, take-home messages from this. And the main thing I think is that हमारे IVF के patients, हमारे PCOS के patients, they can all be treated so well. And of course, talk about insulin resistance. So before we put up our queries to you, let us hear from Dr. Sharda Jain, ma'am. Ma'am, your comments, please.
My comment will be only a 1 minute comment before Dr. Sangeeta makes a comment, because we have to have another presentation by Dr. Geeta, that I've seen a bariatric surgeon in making. I have seen it's a hard work, but in the last 2 decades I've seen things have really smoothened out. One person of the family gets cured, brings a whole lot of family members. And that's the way things go on. I will only touch on the infertility side of it. Nearly 60, close to 60 people who have got a bariatric surgery done by Dr. Yogesh, and I always tell him that once a bariatric surgery is done by you, their amenorrhea of 9 months, 1 year periods they used to have, it gets corrected in 3 months' time. Magical. And we always counsel them very nicely that don't become pregnant. Wait for a year minimum. It will be good if you can wait for 2 years. You can take it from me. Majority, that is 2/3, conceive on their own. कुछ भी हमारी जरूरत ही नहीं उनको. So once you suggest them, the people who have had an IVF failure before, 1, 2, 3 failure के बाद जब वो finally agree होते हैं कि जी हमने bariatric surgery कराना, they conceive on their own. Purnima is not here. Purnima will say her daughter is an ambassador of bariatric surgery. And so many family members of ours have had a bariatric surgery. They have become mother on their own without we people helping them out. So he has definitely seen, I have seen the magical effect as far as the diabetes is concerned. People on a very, very heavy dose of insulin, it just disappears in 2 months of time. And Dr. Yogesh, it's a pleasure to watch many cases of ours who had a cirrhotic liver. Previously, we used to hesitate, once it is cirrhosis there, bhaiya Yogesh, yahan par mat karna. But we have found it, the surgery has been done and even cirrhosis can revert back. So with this, I will ask Dr. Sangeeta to make a comment on it. Dr. Sangeeta.
Ma'am, unmute yourself, please. Dr. Sangeeta.
Dr. Sangeeta Gupta.
Congratulations, Dr. Yogesh, for such a beautiful, crystal clear and a picturesque presentation. You know, your pictures made us understand the real problem behind obesity, the effect of bariatric metabolic surgery, as well as the role of counseling and everything. And you very rightly said, we eat before eating, we eat after eating. And that is the problem that is the basic cause of obesity. And so we all have to take a pledge today that we have to limit our calorie intake. It was a beautiful presentation and it was so informative. Thanks a lot of you.
Thank you, ma'am.
Thank you, ma'am.
Dr. Gupta, you want to make any last comment, Harish?
Yeah, absolutely. I always say the presentations of Dr. Yogesh are as scintillating as his surgical skills, which we have seen in his life surgeries. Always a pleasure. My only comment is that a person goes to 150 weight from 70, 75. We should not, as a primary care physician, it's a duty of our GPs and all of us, so that when we see our patients progressing to that level of their BMI increasing, we should stop them. It is not good that we allow them to go to that level and then we operate. It is a duty of all of us in the medical fraternity to guide them, counsel them, and stop them at that level so that they don't progress to that morbid obesity. Second is, Dr. Yogesh, which patients of diabetes will you recommend that they do need bariatric surgery? And third, we should make an endeavor that there is a cost involved in this surgery, so that the government should also take up this surgery in government hospital, so that the common man is also benefited by this very life-saving surgery. Dr. Yogesh, which type of diabetic patients will you recommend that they do need bariatric surgery and they should give up medical treatment now?
Thank you, Dr. Harish. I fully agree with your thought that we should, in fact, care our patients so much that they don't proceed to the next level requiring bariatric surgery. This is our moral duty. Well, now talking about which patients of diabetes require surgery, any individual who is above 35 BMI with a uncontrolled diabetes of 1 year duration on medication is a candidate for metabolic surgery. Secondly, on the investigative part, if their C-peptide levels are below 3, they are a candidate for metabolic bariatric surgery. So basically, when to achieve the best of results and best of remissions, it is stated that a diabetes should be of less than 10 years duration and should be operated earlier than later in one's span of diabetes care.
Thank you. Thank you, sir. So basically, there should be no hesitation probably from our side to refer our cases of obese patients for bariatric surgery. Basically, we were actually trying to reach that cutoff of 35. Do you think, Dr. Yogesh Agarwala, sir, and Dr. Harish Gupta, that we should actually refer our female patients much earlier, or should it first touch the 35 BMI cutoff?
As you would have seen, one of our studies, which we did about 5 years back, we did them on patients, uncontrolled diabetics between 30 to 35 BMI, and they gave equally good results. Most important is if the person is a uncontrolled diabetic with impending complications, micro and macrovascular complications, it is better to intervene earlier than later. And BMI 35 is not a cutoff, but it is just as a working guideline. So as surgeons, we don't misuse the liberal cutoffs and we start operating at extremely low BMIs. So it has to be a case for lower BMIs. It has to be a case-based evaluation, a thorough understanding of the patient, and the patient also understanding what procedure he would be undergoing.
Absolutely.
Thank you so much.
I think, Dr. Divya, we will wind up here, because now the WHO, all bodies have been recommending that, bariatric surgery should be done earlier than late. So thank you, Dr. Harish. Thank you, Dr. Sangeeta, about this. Now we will take another stalwart